Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. As we make plans to enjoy the outdoors this summer, a common risk we run into in Larimer County is West Nile virus. This week, we're joined by Alison Barbee, Communicable Disease Epidemiologist here at the Health Department, here to tell us a bit more about West Nile virus and the steps we can take to protect ourselves and our loved ones. Alison, thank you so much for joining us.
Yeah, thank you so much for having me be here.
Can you tell us what West Nile virus is?
West Nile virus is a vector-borne disease that's commonly spread by infected mosquitoes. It was originally introduced to the U.S. in 1999 and Colorado in 2002, before we had a really big outbreak. Culex mosquitoes that are able to transmit West Nile virus are found locally and in many other parts of Colorado. These look like medium-sized mosquitoes. They typically feed around dawn and dusk, and some of them have like a zebra stripe pattern on them.
Do you know where West Nile virus got its name? Why we call it West Nile virus?
This is a fun fact. West Nile virus was first isolated from a patient who was from the West Nile district of Uganda in 1937.
If you do get West Nile virus, what are the symptoms?
Yeah, so for people who do develop symptoms, it usually feels like a mild flu. So some of those symptoms could be a fever, headaches, body aches, tiredness, generalized weakness. I do want to also add that 1 in 150 people who develop symptoms from West Nile virus will get seriously ill. So some of those symptoms can include a stiff neck, altered mental status, seizures, encephalitis, and polio-like paralysis, a sudden onset of muscle weakness, and loss of reflexes. Recovery from these severe illnesses can take several weeks or even months. Additional information for symptoms is they usually start about 2 to 6 days after you've been bit by an infected mosquito, but it can range from about 2 to 14 days after being bit. Majority of people who experience symptoms will recover completely, but may experience some fatigue, weakness, or other symptoms that can last for weeks. Most people who get West Nile virus won't even know they have it. About 80% of people show no symptoms at all.
For those cases that do experience more severe symptoms, do they usually start with those same sort of flu-like symptoms as other cases?
That's a great clarification. Yes. So people who have that neuroinvasive illness can also experience those fever, headaches, body aches, and then they progress.
And who is most at risk for those more serious cases of West Nile?
People with health conditions such as cancer, diabetes, high blood pressure, kidney disease, or individuals who take medications that suppress their immune system. You're at a higher risk for serious illness if you're over the age of 55. 1 in 50 people in this age group will get severely ill if they're infected with West Nile virus. I also want to note that severe illness can occur in people of any age.
So what can people do to protect themselves from West Nile virus?
The best way to avoid a West Nile virus infection or disease is to prevent mosquito bites. If you have planned outdoor activities during peak mosquito biting times, which is between that like dawn and dusk time, we really do recommend using EPA registered insect repellent and or wearing loose-fitting clothes, long-sleeve shirts, and pants.
So what can homeowners do then to kind of protect against mosquitoes?
So homeowners can protect themselves against mosquitoes by installing and repairing screens on windows, doors, even using air conditioning rather than opening their doors to give that lovely breeze, which I also really love, especially in the spring. This time of year, it's delightful in the morning. But we recommend using those screens to help prevent mosquitoes from getting indoors. We also recommend that they empty standing water from containers around their home at least once a week. This includes anything from flower pots, gutters, buckets, pool covers, those pet water dishes you leave outside and you forget about.
At the community level, a number of municipalities in Larimer County spray to help control mosquitoes. Can you tell us a little bit more about that process? Specifically, what is the protocol for spraying and who decides when we spray?
Larimer County does not currently run its own mosquito control program. However, many local municipalities work with Vector Disease Control International, also known as VDCI, to manage those mosquito control areas, and they use that adulticide spraying or other larvicide application to help minimize mosquito population.
What's actually being sprayed when municipalities spray, and what does it do?
They use EPA-registered adulticides, which are used during those spray events, or also known as fogging events, to minimize those adult mosquito populations. These products have been extensively tested for human and environmental safety before they're used. Also, the method of applying this adulticide is called ultra-low volume spraying. Now, this method is a common industrial mosquito spray technique that is primarily done from the back of a truck. The primary benefit of this type of method of spraying is it requires very little product and it treats a large area of land. So to put it to scale, typically about an ounce of adulticide is enough for 1 acre of land.
And is there a way that people can know if there's going to be spraying in their area?
Fort Collins offers a text alert service to notify residents about spraying. And to sign up, you can either text or go online. To text, you can simply text FCWNV to 888-777 to receive those text updates. Otherwise, this information is also available on our website.
So tell us, what kind of work the health department does that's related to West Nile virus?
Our communicable disease team monitors and responds to all reported human cases of West Nile virus infection in Larimer County. These cases are reported to public health from physicians or laboratories when a patient receives a positive blood test result. Once we receive a new West Nile virus case, our team will interview individuals to determine their case classification through the individual's clinical presentation, illness onset, and what their illness outcome is. We also provide education on the most effective way to prevent West Nile virus infection and disease and help to refer people for more treatment or care as necessary. Our team also provides weekly public health recommendations to the city of Fort Collins on areas that have a higher risk of people becoming sick with West Nile virus, when an area has a high number of mosquito traps with mosquitoes that are infected with West Nile virus.
That kind of brings me to my next question. I'm interested in the data collection process. You mentioned mosquito traps. Can you explain what those are?
BDCI conducts most of the mosquito surveillance program in our community. They help with the data collection side of it, and this includes everything from mapping out potential mosquito breeding sites. They also use these traps that you just asked me about for adult mosquito activity that they start around June and end in September.
So how many of these traps are there then in Larimer County?
Larimer County has approximately 104 traps
Oh.
that are located within Fort Collins, Loveland, and Berthoud.
So what happens then when the mosquitoes are collected? What is the process then to determine, oh, there's West Nile in this area, it was captured in this trap? How does that work?
Sure. So, once mosquitoes are collected by BDCI, they're ID'd for their species and their sex, and then they're tested by CSU for West Nile virus and St. Louis encephalitis.
So how do you translate that data into risks for specific areas?
Right now, different municipalities and groups use what we call the vector index. The abbreviation is VI. This is a measurement tool that is proven to be useful predictor of human risk of West Nile virus infection and helps to guide public health recommendations for mosquito management practices. So the VI measures how many female Culex mosquitoes are infected with West Nile virus in a given area, so within those traps. Studies have shown that when the VI is above 0.5, the risk of human infection increases.
What does that testing process look like? How do you test a mosquito to know if it has West Nile?
We partner with the EBOL lab at Colorado State University, and they also partner with other local municipalities within Larimer County to test the mosquitoes. They essentially take the mosquitoes and then they process them and analyze them in the lab through the use of a test called the polymerase chain reaction, also known as a PCR test.
So, like a COVID test uses PCR.
Yeah, that's a great comparison.
This season, you helped build a new dashboard where Larimer County residents can see West Nile virus data. Can you tell us about the dashboard? and the data that it shares?
So this dashboard provides weekly maps of the current and prior week of mosquito trap data for all of Larimer County. These maps are interactive and they highlight mosquito traps that have positive Culex mosquitoes during that current and previous week of trapping. You'll see on the map that there's a 1 mile radius, which is highlighted in red, from a mosquito trap, which represents the immediate risk of being bitten by a mosquito infected with West Nile virus. We also have a search function in these maps that you can use to identify if your home or the place that you're going to recreate may fall within this area of risk. We also have information about human case data. So there's some pretty cool, I'm biased, but we have some pretty cool graphs that show the 2025, 2026 seasons of West Nile virus cases in comparison to the 5-year average. We also have a cumulative West Nile virus graph that shows each of the past 5 years of human cases of West Nile virus in Larimer County and seeing if the trends how close they are together, what years were higher, what years were lower. And it kind of just helps people see what is this year looking like compared to last year or the year before that.
What did the development process look like on the back end for that dashboard?
It began at the end of the 2025 season, where our communicable disease team was working on better methods of mapping out where positive mosquito traps were located in Fort Collins and trying to provide evidence of areas we would recommend adulticide spraying. I then created a time-lapse application through our programming software that helped to visualize the positive trap data throughout the 2025 season, showing that immediate risk to West Nile virus and the dispersal range of Culex mosquitoes and how it kind of fluctuated week to week. It was interesting to learn, but Culex mosquitoes typically don't fly long distances. They have been recorded to fly up to 8 miles or even can disperse up to 20 miles, depending on environmental factors. But after consultation with a number of professionals within our community for West Nile virus, we did kind of land on that 1 mile radius of immediate risk in comparison to a mosquito trap here in Larimer County. After creating these visualizations led to further conversations with other West Nile virus stakeholders and public health groups that had a greater interest in seeing that week-to-week data on the local positive pools and help demonstrate that flight path range through buffer zone visualization, essentially just helping people see what's going on, what do they need to do, and help understand the impacts to people and how many people are getting sick and what can they do as the viewer of the dashboard can best protect themselves during the current season.
So it sounds like the dashboard offers really hyper-local information so that you can plan activities throughout Larimer County if you need to shift from one area to another based on risk level.
Yeah, I think that's a good way of putting it. The data is collected the week prior, so we're kind of working on a 1-week delay, but we're able to best understand, especially if there is no spray events happening in your community, to know that if there is positive mosquitoes 1 week, there is a greater likelihood that there might be positive mosquitoes that current week that you're seeing.
If people would like to explore the dashboard or learn more about West Nile virus, where can they go?
There is a link to the West Nile virus surveillance dashboard on Larimer County's main West Nile virus page.
Awesome. Alison, thank you so much for joining us.
Thank you both so much. This was a pleasure.
Do you have a question about public health in Larimer County or a topic you'd like us to discuss? Let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.